Bismillah, walhamdulillah, wassalatu wassalamu ala rasulillahil kareem. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to our show today. Inshallah, we will be discussing a very important topic of cancer screening. And to discuss this topic with us here today, we have two guests who will be joining us online via Zoom. We have Dr. Suhana Begum, who is a health psychologist. We also have Dr. Rumina Mirza, who is a medical consultant. So before we begin, I'd like to ask each of our guests to say a few words about themselves and the kind of work they do. So if I can please begin with Dr. Suhana Begum.
Thank you very much. Assalamu alaikum, everyone. Thank you very much for having me today. So as the sister mentioned, I'm a health psychologist, which means I specialize in looking at health behavior change. So how can we encourage people to change their behavior, to have a healthier lifestyle and kind of take steps towards health protective behaviors. So cancer screening is a really good example of that. So steps that we can take to protect our health.
Thank you for that, Dr. Suhana. And Dr. Rumina, if I could ask you next, please, to say a little bit about yourself.
Sure. Assalamu alaikum, everyone. Thank you very much for having me. I'm a medical consultant. I work in South London at Lewisham Hospital. My subspecialty is respiratory medicine, but I'm also a general physician. So I do clinics, I see patients on the wards, I do on-calls and get medical referrals from A&E. So that's what I do. And we see a lot of cancer, different types in A&E, but also in clinics. So I have some exposure to that.
Okay, thank you very much for that. So I'll start off the discussion then. So we hear a lot about cancer these days, and our first thoughts are, of course, it's it can touch anybody's lives at any moment. We know that we have friends, family, we have colleagues who've been affected by cancer, and it's so widespread, subhanallah. And even in the Muslim community, I think we find, though we have solace in knowing that everything that happens or any affliction which we face is from Allah subhanahu wa ta'ala, there is still a lack of education or awareness about cancer, cancer screening, especially for women. We have all sorts of cancer screening. It could be breast cancer, it could be cancer of the womb. So going for regular tests to ensure these. So of course we have a lot to discuss, but if I could just start off with a very simple question to both of you. What is cancer screening? And if you could also take time to tell us, how is it conducted? What does it involve? And I know I've wrapped up a few questions in there, but how are we likely to be called, or at what point in our lives are we likely to be called? Or is there a certain basis, or is there a certain litmus test by which we're assessed to see if we will be called? So is this for everybody, or is this dependent on your situation? Just I guess if you're unlucky.
Sure. So Zahan, I'm happy to take this question to start if you want. So first of all, from the beginning of my training, the likelihood of somebody getting cancer, any cancer, was maybe 1 in 4. But even throughout my training and now, it went from 1 in 4 to 1 in 3 to 1 in 2. Yeah. So the likelihood is, as we get older, somebody you know or even yourself is going to get cancer. So what cancer screening is, there's lots of different types of screening depending on the type of cancer. In the UK, we predominantly screen generally for 3 cancers, so bowel cancer, breast cancer, and cervical cancer. So that's the opening of the womb. There's different ages that people are called in, and that's relevant. So of course, the last 2 are for females. Bowel can be male or female. So depending on your age, you will get called for those screenings. So each screen for a different cancer is quite different in terms of the tests you have. There are, of course, lots of other cancers. So for myself, lung cancer is something I see a lot of. Obviously, brain cancer, lots of other things, but there's no screening for those. So you won't get called up to have a test to screen for it at a certain age. But there are symptoms that you should look out for that should make you go to the GP, and I can go through that afterwards. But in terms of the screening test, so we'll start with the gynecology ones, obviously relating to females. So breast cancer, it starts from the age of, I think, around 50 to 70. And the test for that is a specific type of scan called a mammogram. It's sort of an ultrasound. It sort of looks at your breast tissue and sees if there's any lumps there. It's really important for women to check themselves for lumps, and if they find something, to let their doctor know so they can get a scan even before the screening happens. So that, I would absolutely say that women should go for the screening for the breast cancer. Whenever you're called, you should go up for it, because it does detect some of the cancers before you might see the symptoms. And recently I've had 2 patients in their early 40s who have had cancer who've spread everywhere, and both were ethnic minorities. So it's really important that some people don't know. Yeah, so you don't know when it might affect you, what the symptoms are until later stages. So the screening, the reason it's important is because it potentially could, inshallah, pick up something early, which means your chance of treating it is going to be more successful.
So Dr. Rumina, I just wanted to interrupt you for a moment and ask you. So I noticed that you said breast cancer is something that tends to affect women in their 50s, but you also mentioned that you know women from early ages of 40. So are we really saying that women can be affected much earlier, even though 50 onwards is the age at which probably they're at most risk?
Absolutely. So there's symptoms. So the screening happens from, they have to make it generic, and you don't screen young women because your breast tissue is denser. So actually, if you have a scan, it's quite hard to pick up things on a general scan. So we don't do general screening, because if you start with 30-year-olds, your pickup rate is lower. And of course, the scan is not as accurate because of the tissue of a younger person. So it's generically for 50-year-olds. However, if you're before 50 and you feel a lump, or there's changes of your skin around the breast area, or you start getting abnormal pain or discharge or something like that, that should alert you to go and speak to your GP before your screening starts. If you don't have any of those things and you reach the age of 50, at that point, you should, if you get called up and you should get a letter, you should go and attend that and have your screening. And I made sure my mum did that, because she had it, she didn't do it, she didn't show me her letter. And then when she finally did, I told her to go, and alhamdulillah, it was fine. The difficult one that people have is often cervical screening. That's a sort of internal test to look for the opening of the womb. That's, I believe, quite a lot earlier, in the mid-20s. Now, I would suggest Islamically and for women, it's a difficult one to see whether you should have that. So I would say pre-marriage, the chance of you having cervical cancer is quite low. I'm not saying it's zero, so having to go to that before you're married, I don't think is essential, and I'm sure Suhana will give her opinion on that as well. However, after the age of marriage, when you're called for the every 3 years as a screening, again, I would suggest women to go for that, because especially cervical cancer,
so we do,
it doesn't really, it doesn't really give you symptoms until quite late stage. So it's known as a silent killer. So that one, for the screening after marriage, I would absolutely suggest that you go for those every 3 years. Okay,
thank you so much. And if I can move on to Dr. Suhana now and ask you, so as we said, we receive invitations. So can we talk about some of the cancers that we will receive invitation for, and the fear that is related to it? So women react differently. You know, some will just slip away the letter and put it away and decide not to even tell their family members, or you know, others will hold on to the letter and keep putting it off. You know, saying I'll go next week, next month, and it turns into years. What would you say to people like that?
So I think just to sort of, so to answer your question, I think firstly, just to understand what screening actually is. So screening is a test that they do just to check if you do have anything that might lead on to being cancer. So at that point, it doesn't mean, you know, if you get a letter for an invitation to a screening, it doesn't mean that they think you have cancer, or that it's anything particularly to worry about at that stage. It's just a precautionary check to check whether you have cancer. And the reason why, as Dr. Mirza mentioned earlier on, there are 3 programs in the UK. So there's breast cancer screening, cervical, and bowel cancer screening. And so those are the 3 that you will be routinely invited for, and there's set ages for those. So for breast cancer, it's between 50 and 70. For cervical cancer, it's between 25 and 64. But as Dr. Mirza said before, if you're over the age of 25 but unmarried, I think your chances of developing cervical cancer are lower. And then bowel cancer is from 60 to 74 years. So I think the main thing to point out is it doesn't mean that younger people can't get those cancers. So if you do, I think it's really important to know what some of the signs and symptoms are for certain cancers. So for breast cancer, for example, if you have a family history of breast cancer, then you are at an increased chance of getting it. So if you notice, so it's really important for women to be aware of what some of the symptoms are. So just notice if they notice any changes, in their body, anything sort of feel any lumps, any changes in like the texture of the skin, things like that. They just need to be aware of that and make sure that they do seek help. In terms of what you said, sister, about kind of, sometimes people get a letter and they kind of put it off and they think, oh, I'll maybe go, I'll go next week or I'll make that appointment or I'll do it and just kind of, put it off. I think it's really, really important to, as soon as you are invited to a screening, to try and go and make that appointment and go as soon as possible. The reason why they have cancer screening is to try and catch it as early as possible. And the earlier you catch it, the better the outcomes are. So just and I understand, sometimes it can be a little bit it can be a little bit scary to, because you might not be sure what's going to happen, or you might not understand what the process is. So I think it's and that's understandable. It can be a little bit scary, but I think what I'd really say to anyone who's a little bit worried is maybe speak to somebody about it. Especially if it's, an older family member, like Dr. Mirza was talking about her mum before. So, if it's an older family member, check in with your older family members, have they had letters, and maybe just talk to them about what the process is. So, a mammogram, for example, it's an X-ray of the breast tissue. So what does that entail? What does that involve? To have a conversation with them and try and allay their fears a little bit. Cervical, screening is a little bit uncomfortable and it's very nice, but I think just it's kind of part of being a woman. So just actually talking to people about what it entails and just to kind of try and allay their fears a little bit and kind of allay their worries about it. And I think actually with the bowel cancer screening, you can get test kits to do at home as well, so that you can do it at home and then send it off for testing. So with that one, you don't even have to leave your home. So there's different different screenings work in different ways, but really I think just actually finding out as much as you can about the screening before you go can really just help to kind of put your mind at ease a little bit.
So on that note of you just mentioned bowel cancer screening. So now on that note, I just wanted to ask you, so we obviously our focus is on women when we talk about breast cancer, but when we talk about bowel cancer screening, we're of course talking about male and female. So, this could be members of your family, and this is why it's important to speak openly, not just to the women folk in our family, but also male, because I think men can also avoid these situations. They might receive a letter and think, oh, I couldn't possibly, be one of those people, or, you might have somebody in the community, a friend or family, but you don't really think it's going to be you until one day it does happen. So can I ask you, Dr. Suhana, to say a few words, and then I will also ask Dr. Rumina, so while we're with you.
Yep, so I think that's a really good point that you've made there, sister. This affects cancer can, as we said earlier, cancer can really affect anybody. It doesn't, it doesn't really discriminate, so it can affect anybody. So that openness is really, really important. So if if you have got a family member who fits into that age bracket of the cancer screening, so for bowel cancer, it's from 60 to 74, and there are actually plans to expand that to 50 to the 50 to 59-year-old age group as well. So have a conversation with them, say ask them if they've received a letter, if they have they might have already been sent a test kit, a home test kit as well. So actually just talk them through the test kit. I think sometimes with men, we know that sort of across all health conditions, we know that men are less likely to seek help than women. Men are more
Yes.
likely, if they have symptoms, they're more likely to kind of brush it off or just think, oh, it's just tummy ache, or it's going to go away by itself, or maybe just take a paracetamol or something like that. So actually, speaking quite openly is really important, and making sure that they're aware of the different symptoms of it. So things like changes in like bowel habits, noticing blood in your stools, things like that. So just being quite open and sort of having those conversations, and actually encouraging them to seek that help. So encouraging them to go to the doctor if there is anything that they've noticed that feels a little bit unusual.
Thank you so much. And can I also go to Dr. Rumina, please?
Sure. As Dr. Begum said, exactly. I think some of the topics to discuss and the symptoms can be embarrassing, especially in sort of whether it's within your family or culturally. You don't necessarily want to talk about your deep and personal symptoms, but I think asking about it or allowing a space where people feel comfortable talking about it. And as Dr. Begum mentioned, there's things like bowel motions people get worried about, that they're talking about their what they're passing in the toilet. So I think it's important to allow that to be open, so that if they have a symptom and they're worried and and you're a family member, whether it's a parent or a sibling, they have somebody to talk to, and then you can be the one to encourage them to go and see the doctor. And it might take persuasion. They won't go to the doctor as easily. Again, men do tend to not seek help, but it's at least urging them or keeping an eye out for the symptoms. Or they may not know it's abnormal, so they might mention it in passing. But it's being sensitive about it, and being able to talk about it with them feeling comfortable discussing it with you. So I would absolutely agree that it can affect men and women, unfortunately. And those three are the ones that are screened for. There are others that we also have to be aware of, again, affecting men sometimes more than women, and vice versa. So, for example, lung cancer, if you've had a cough for several weeks or months and you smoke, that automatically should mean you should go to your GP and at least have a chest x-ray. And obviously passing blood in feces, coughing up blood is another one. And one that doesn't differentiate between men and women is if you have drastic amount of weight loss that you've not planned, but suddenly you've lost lots of weight. That should be something you go to your GP for, to have that investigated.
So there's lots of signs, aren't there, Dr. Rumina, and it can be really confusing for somebody who doesn't have so much knowledge on them. But like you said, it's easier in some ways, because if we just look out for these signals, as you said, if you're bleeding, if you have blood in your feces, if you're feeling very poorly, or you suddenly lose so much weight and it's unexplained. But we also find, if we flip the coin, on the other hand, sometimes people are seeing their GPs, they're being sent for tests and they're seeing their consultants, and often they can get either misdiagnosed or the cancer doesn't get picked up. And that does happen, unfortunately. But again, I guess it ties in with what you and Dr. Suhana are saying, that if you have these regular checks, then you can... I guess you can avoid that happening, because then when it comes to really serious symptoms and then you go into your GP, it's quite a daunting task for them to be able to rule out, all other possibilities, and then to look into cancer. So I guess what we're really saying is, if you have awareness about these things and you know when to be checking, what kind of symptoms to be looking out for, then we can avoid even being misdiagnosed, because we've looked after ourselves. And so when you get to the point of seeing a GP or a consultant, you can actually give them a record and say, well, I've had these regular checks and these are my results, and hopefully they can rule out in a more methodical manner and get to the diagnosis more easily. Can you say both, please, comment on that, beginning with Dr. Suhana?
Yeah, I mean, I think that's a really good point. So I think the most important thing I would say is, everybody knows your own body. So you know your own body best. You know what's normal for you, what's not normal for you, what how you're if something, if you get a pain or if you get, something that just feels unusual, I think, I would really always say trust your gut instinct and kind of, just see if if that's normal, whether that's likely to go away or not. And then if you're not sure, then always speak to somebody about it, speak to a GP. I think there is a chance that you could be misdiagnosed, but I think, from my perspective, I do think it's better to be safe than sorry. And actually, if you do go to your GP and it is picked up early, then I think that's obviously a positive thing. So I think it's just being really honest with yourself and trying to kind of try and seek that help as soon as possible. So just understand what's abnormal for your body, understanding what might be concerning. And this is especially things like, if you've got blood in your stools, that's obviously a very obvious sign that something isn't right. But things like, having tummy aches or things like that aren't maybe feel as serious as symptoms. But actually, if you have got a concern, just making sure that you do go to your GP and speak to them about it.
So, yeah, thank you for that, Dr. Suhana. I think what I was really trying to say is sometimes, you've been to the doctors and you've had many tests done, and unfortunately, I know of people, friends and family, who've gone through that search. I mean, as shocking it is when you first find out, that something is wrong, and when you're being checked, being screened for cancer. But what I'm really trying to say is sometimes early on it is missed, and then what you find is when the symptoms have increased, for whatever reason, we go on, and then the patient finds out, a year later, even on some occasions, that they have cancer. So why does that happen? I mean, is there any explanation for that? Why do we miss it?
So that's a good question. And I think a part of it is also, so when people go to the doctor, sometimes it's important, obviously, to have things checked out. But when the symptoms that are presented to you, if they're not clear and they're a bit jumbled, it can be hard for the doctor from the other side to try and figure out what it is that is causing the problem. So that's why being aware of the symptoms, that what we call our red flags, which are bad symptoms that you must always seek help. So things like the blood in the feces, coughing up blood, sudden weight loss, those things will get you seen by a doctor, and then it will generate tests such as CT scans and follow-up in cancer clinics quite quickly. You might not have cancer, but alhamdulillah, you will go through that pathway. So for example, for our lung cancer clinic, if you've coughed up blood and you're a smoker, we will order a CT scan before even having met you, and then have a follow-up to review the scan, which is a 3D picture of your lung, and either say you need to come in or say you don't have cancer, so it's fine. The difficulty arises is when people go to the doctor and they have general symptoms, so for example, fatigue, but they can't really pinpoint what their symptoms are. And sometimes you might ask, do you have breathlessness? And they're sort of, yeah, a bit, or do you have a cough some days, So there's nothing specific, and it's a general thing. That is quite hard for the doctor to try and put it all together and come out with a diagnosis. It might be something, but you will go through a path where you do blood tests initially. You might have a general, just a 2D X-ray, and then you'll have some other tests, and then it will follow on. And it's more when you get the symptoms that are tangible and will generate that scan. So it's a tricky one.
Yes.
But I'd like to think it does happen, but the reason we hear about them is obviously because it's a shocking thing and sad, and that's why the information is spread. But in the NHS now, I guess I'm in hospital medicine, so if I want a scan, it's much easier. I think in the community, GPs really do have a hard time with seeing lots of patients, and everyone's really worried. Much as we should be careful and have things checked out, you also get the other side where everyone is so worried about every symptom, and their fear is they have cancer. And in those situations, if they present to the GP several times,
absolutely,
you might be at risk of having some tests, but actually then being reassured, and then after a time, if you have something, it's a, I've been telling you for a long time. So it's a really tricky one, and it requires sort of a sensitive doctor, but also communication between the two. And also, if you are going to the GP, try and think about the timeline of your symptoms, what the symptoms actually are. The more specific you are, the easier it is for the doctor to try and think about the tests that relate to you. When it's a bit vague, it makes it harder for us.
Of course. And perhaps keep a record as well of, how your symptoms progress over a period of time. Thank you so much, Dr. Rumina. That was our GPs do clearly have a hard time, and we should try and help them in every way possible, because they are trying to help us. And with that, we will take a short break, and we will come back and discuss further. So see you shortly. Assalamu alaikum wa rahmatullahi wa barakatuh.
অভূতপূর্ব সাড়া।
It's very educational.
It's opened my eyes, really informative.
আবেগপ্রবণ হয়ে গিয়েছিলাম দেখে।
ফুল হাউস।
1,500 people turned up.
লন্ডন, বার্মিংহাম এবং ওল্ডহামে 5টি সফল প্রদর্শনীর পর মসজিদ আল হারাম এবং কাবার উপর নির্মিত ফিল্ম ওয়ান ডে ইন দ্য হারাম আবারও আসছে। বার্মিংহামে 14 নভেম্বর সোমবার বাদশা প্যালেস, নিউ ক্যাসেলে 22 নভেম্বর মঙ্গলবার দ্য ফেট। টিকিটের জন্য ভিজিট করুন tv1uk.tv/events। পরিবারের সবাইকে নিয়ে ফিল্ম উপভোগ করুন এবং আল্লাহর দিনের দাওয়ার কাজে সহযোগিতা করুন।
পাকিস্তানের বন্যার ক্ষত এখনো শুকায়নি। এখনো প্রায় 33 মিলিয়ন পাকিস্তানবাসী অসহায়। প্রায় 20.6 মিলিয়নের প্রয়োজন খাদ্য, বাসস্থান, চিকিৎসার মতো জরুরি সহযোগিতা। আর এই শীতে খোলা আকাশের নিচে বসবাস করছে লাখো পাকিস্তানি ভাই বোনরা। মানবিক সংস্থা পেনি অ্যাপিল বন্যা পরবর্তী পুনর্বাসনের জন্য কাজ করছে নিরলসভাবে। হাতে নিয়েছে রিবিল্ডিং পাকিস্তান প্রকল্প। বিস্তারিত জানতে এবং সহযোগিতা করতে পেনি অ্যাপিলের রিবিল্ডিং পাকিস্তান লাইভ অ্যাপিল দেখুন 11 নভেম্বর শুক্রবার সন্ধ্যা 7টায়।
ইস্ট লন্ডনে বাঙালি খাবারের বেস্ট চয়েস ফিস্ট, গরম গরম পরোটা এবং দেশি ব্রেকফাস্ট, মিক্স গ্রিল প্লাটার, হান্ডি কুক মিট কারি, স্পেশাল কাচ্চি বিরিয়ানি, রূপচাঁদা ফ্রাই, রকমারি ভর্তা, বাফেটে আপ টু 30 আইটেমস, যত খুশি তত খান।
এ যেন মায়ের হাতের রান্না।
পার্টির জন্য 2টি প্রাইভেট রুম সহ 180 সেট, থাকছে 20% ডিসকাউন্ট।
Truly authentic Bangladeshi food ready for you.
ফিস্ট অ্যান্ড মিষ্টি, হোয়াইটচ্যাপেল মার্কেট, লন্ডন।
পার্কিং বাংলা টাউন ক্যাশ অ্যান্ড ক্যারি নিয়ে এলো বিরাট সুখবর। ইউকে অর্থনীতির রেসেশনের মধ্যে পার্কিং বাংলা টাউন ঘোষণা করছে হাফ টার্ম হলিডে সেল আগামী 1 নভেম্বর থেকে 10 নভেম্বর, মাত্র 10 দিনের জন্য অবিশ্বাস্য সেল। রামফোর্ডের হালাল আস্ত ভেরি মাত্র 150 পাউন্ডে, আর হাফ ভেরি মাত্র 80 পাউন্ডে।
5 কেজি গরুর মাংস অনলি 20 পাউন্ড। এই সেল কেউ মিস করবেন না।
এছাড়া ফ্রোজেন ভেজিটেবল সহ অন্যান্য পণ্যের উপর তো সেল থাকছেই। পার্কিং বাংলা টাউন ক্যাশ অ্যান্ড ক্যারি।
Royal Regency, a stunning wedding and events venue. Glamorous, elegant, luxurious, 1100 seating capacity, in-house catering facilities. Make your special day unique. Turn your dream into reality. Celebrate with Royal Regency. Call 020-8478-6020.
TV1 and Inspired by Islam presents National Quran Competition The Voice of Oneness 2022 Grand Finale, Sunday, 4th December. Venue, the Royal Regency, London. থাকছে recitation, nasheed, children performance, motivational speech এবং delicious 3-course meal. পরিবারের সবাইকে নিয়ে উপভোগ করুন। আপনার টিকিটের জন্য ভিজিট করুন tv1uk.tv/events।
Question forward. So we talked about how breast screening, breast cancer screening, bowel cancer screening, and cervical cancer screening. So these three tend to be the main screening which we will be invited for throughout our lifetimes. So can I put this question to Dr. Rumina, if I may? So how are these procedures? So first of all, at what point in our lives will we be called out? And when we are called out, what's the procedure for each one of them? And if I may also ask Dr. Suhana, please, if you feel there's something you can add to that, please do after Dr. Rumina comments. So
I'm sure. So we'll start with bowel cancer. So that's usually at the moment starting at age 60, but as Dr. Begum said, they're looking to bring that earlier to the 50. But for now, it's from 60 onwards, male and female will be called to have this screening. It's done every 2 years, and it's a home kit test, and it's a fecal sample, which in essence is a poo sample.
Right.
So it means that you have to take a sample in your bathroom, and then it's a swab, and then you put it back inside the packet, and then you post it back to the centre. I think it takes a few weeks for the results to come back, but they can often, well, not often, but they can potentially detect early signs of bowel cancer on that. And so obviously it helps to pick things up earlier when you might not otherwise have seen. So of course, if you have lots of blood in the toilet, that's obvious, and it should generate a referral to go and see your GP. But this detects sort of also the small amounts, and it's part of the screening process. So even if you have one and it's fine, alhamdulillah, but 2 years later, you will have another one and you should have it again. Just because it was normal once doesn't mean it's going to be normal the next time. So you should have it every time you're called for it.
So can I quickly add something else to that? Because just as you're saying that, I thought about, how you're talking about, having blood in your stool. There are other diseases which, you can have blood in your stool. So how do you differentiate? So for example, I don't know medically about these diseases, but I've heard of piles and there are situations where I've heard of, people with this who often think, I might have cancer. Is there an easy way of knowing, or is it best to see your GP?
It's a good question. And actually, I think if you Google it, which you shouldn't do, it's a really hard thing to try and find. You are absolutely right. So hemorrhoids and piles are the commonest cause of the bleeding from the back passage. But it depends on the type of blood, the consistency. But by going to see your GP, they can examine you and see whether or not they're worried about it. And of course, if they see large piles, they would probably conclude that, but recheck you again afterwards just to make sure things have resolved once you've had treatment. If there's other symptoms that come hand in hand with blood in the stool, for example, you have changing bowel habits. So for example, if you're usually regular and suddenly you're getting lots of diarrhea all the time, that's a change of bowel habits. So that would be something that would make them think, I should maybe refer on to a specialist, which is a gastroenterologist who deals with sort of stomach side of things. So no one is expecting you to know which of those is worrying. But if you get it, you go to your GP, who should hopefully be able to have a look to see whether it's hemorrhoids or other things that can give you that is inflammatory bowel disease or of course cancer as well. So you no one would expect you to know if you're not medically.
So best not to Google it then.
No, I would always say the best not to Google it. But take it with a pinch of salt if you do want to. I think it's good for people to educate themselves. I really do. But then go to your GP to see whether or not it's something that needs to be worried. It will mean potentially a finger exam in the back passage. So it's uncomfortable, but it's not painful. And it's something that lets them have a look at whether or not there's anything there that's worrisome.
And of course, it will put your mind at peace as well. If I could just take a moment to invite our viewers to please join in on the conversation. If you have something you'd like to share, or if you've been afflicted by cancer, or you've been for cancer screening and you'd like to share your experience, or even talk about how you've avoided it perhaps, please do call in to our studio. Our number is 0203 515 1764. The number should be up on the screen, so please do call in and comment if you do have something to share with everybody. Thank you. So now coming back to our conversation, thank you so much, Dr. Rumina. And Dr. Suhana, would you like to add to this? So we were talking about, of course, bowel cancer screening, but we mentioned breast cancer screening as well as cervical cancer screening. So perhaps you could say something on that.
Yep. So if we start with breast cancer screening, so as we said, the screening program itself starts at the age of 50, but it doesn't mean to say that women younger than the age of 50 can get breast cancer. So the main thing with breast cancer is if you notice any changes in the tissue. So if you notice a lump, or if you notice kind of a change in the size or in the shape of your breast, or if it feels like the skin feels or looks different. So just kind of being mindful of those changes. So again, just, what I was saying before, just your body, so make sure you're kind of looking out for things that might look different. So if you are invited for a screening, so it's from 50 to 70 and it's every 3 years. And if you are invited for a screening, it's called a mammogram. So it's a special X-ray of the breast tissue, and that's just looking for any kind of changes in the density. So as Dr. Mirza said before, it's looking for kind of areas where there might be the sort of tissue might be a little bit thicker or might look different to the other areas. So that and again, you'll usually get your results within a couple of weeks. So it's the same thing for all cancers. If there is anything that is different, it doesn't mean that you've got cancer, but it does mean that you should seek that support from your GP, and they'll kind of make the relevant referrals. And as you said, sister, it's putting your mind at ease as well, actually, that you have got it checked out. So that was for breast cancer. And then for cervical cancer, so the screening program starts at 25 all the way up to 64. And between the ages of 25 and 49, you'll be invited every 3 years. And then after 49, you'll be invited every 5 years until you turn 64. Again, it doesn't mean that women younger than 25 don't get cervical cancer, but the chances are much less. And as Dr. Mirza said earlier, generally, if you're not married before 25, there's and you get invited for a screening, I think your chances are your risk levels are much lower. So it's probably best to wait until you are married.
Yes.
So the screening itself can be a little bit uncomfortable, but you can sort of take painkillers to help you manage that. But it involves just taking some cells from the neck of your womb, which is the cervix. So it's just taking some cells from there, and then they'll send that away for testing, and then they will, again, you'll get the results in a couple of weeks. So that is, it is a little bit uncomfortable, but usually it's done by a nurse in a GP practice, and, you can request a female nurse, so that if you're worried about that, and they will always make sure, and they will always try their best to make you comfortable as well. They'll make sure that, it's a private room, they'll draw the curtain, things like that. So if if you are at all worried about it, you can definitely speak to your GP when you're booking the appointment, speak to the receptionist, and kind of, they will do whatever they can to make you comfortable for that.
I think that's right. I agree with you. I think it is talked about, and as you said, your GP or your nurse will speak to you and talk you through the steps, and make you as comfortable as possible. And even throughout the procedure, they'll talk through, what they're doing, the samples they're taking, when it will be returned. But I want to put another question forward to you both. So what you will find is Muslim women, and especially in our community, there's another issue, so an issue of shyness. So we understand that, from the Islamic point of view, of course, we know that our Prophet ﷺ has said that even our body has a right upon us. Our body has a right upon us, so, our eyes has a right upon us, and even our wives have a right upon us. So this was when he was speaking to the Sahaba. So we know that our body has a right upon us, and therefore we need to be doing these checks. But I guess what I'm really trying to say is, with women who are not used to this kind of procedures, because you might find that women have come from a very traditional background. So what can we do to make women, how can we talk women into understanding that this is really necessary, and that, it's okay to leave your haya for something medical like this. I would naturally comfort them from, the Islamic point of view, that your body does have a right upon you, and to fulfill that obligation, obviously, you would have to do this. But is there anything either of you can say that to our women in the community, so with regards to when we have this haya or modesty? Dr. Suhana, please, if you could go.
Yeah. I think two things I would say. So one is that, we know that our body is an amana from Allah. It's a gift that Allah has given us. Our health is a gift that, Allah has given us. And, there's a hadith of the Prophet ﷺ who said, take 5 before 5. And one of them is take your health before your ill health. Yes, so actually, we shouldn't take our health for granted at all, because health is something that can change very, very quickly. It can change, even overnight sometimes. So we shouldn't take it for granted. And I think this is kind of, in general, we need to look after our bodies. So we need to make sure, we're kind of being active and exercising where we can. We're making sure we're eating good food, drinking lots of water, getting lots of sleep, things like that. It's in general, we need to take care of our body. And actually things like cancer screenings and making sure we're going to the doctors when there is a concern is part of that, is part of you taking care of your body. So I think, and I think sometimes there is a little bit of, there can be a little bit of shame and a bit of embarrassment, and that's natural, and I understand, and I can understand that. And obviously, as Muslim women, we cover up our bodies to a certain extent. So then going for an appointment where you have to uncover, part of your body which you're just not used to, it can be a little bit uncomfortable, and it can be feel a bit embarrassing, but I think you really have to think that you are doing this for the sake of, trying to protect your health and trying to kind of, look after your body. So it can be difficult, but I think, again, there are things that you can do. So if you are, a little bit uncomfortable, you speak to your GP or to your, the hospital about the procedures, kind of, you can always request female staff. Generally, I think if you're going
like you mentioned, yeah.
Yeah, and I think generally if you're going for a mammogram, for an X-ray for breast cancer scan, it is mostly going to be female staff anyway. Nurses in GPs generally are female staff, so you can request it as well if that makes you a little bit if that makes you a little bit more comfortable. So I think it's trying not to be. I think sometimes we will have to do things that we don't like, but I think trying to remember, what is the greater goal of this, and what is the purpose of it? The purpose of this is to look after your body. And actually it's just, sometimes I think, we live in kind of, tight-knit families, and, you're not, your body and kind of yourself, you're not just looking after it for you, you're looking after it for your family as well. If you're healthy and you're happy, you'll be able to take better care of your family. So thinking of it from that,
to fulfill your role better. Yes, absolutely. Jazakallah khair for that. And actually that brings us to a very important point, which is that our bodies, how are we grateful for our health? As Dr. Suhana said, there's 5 before 5 and health before sickness. So while we are still healthy and well, are we celebrating our health? Are we celebrating the fact that we are well today? That we are living a healthy life, and to show gratitude to Allah subhanahu wa ta'ala, this is what we can do, we can maintain our health. And that doesn't just mean, going for screening, cancer screening and other tests, but also looking after your body in terms of what you eat, as was mentioned earlier in the program, what you eat, exercise, and staying away from stress and staying away from anything that is harmful to your body or yourself, physically or mentally. So if I can lastly put an important question, I guess, how would you say we can balance all these things, our fears and also our responsibilities to our bodies, but also with trying to keep a sound mind and not developing anxiety, and also ensuring, for example, when we have aunties or elderlies in our families, of taking the opportunity to explain these procedures to them. So the younger generation, the men and women who have grown up in this country, perhaps can sit with their parents, their uncles and aunts, and explain the procedure and say, I know you haven't been through these procedures previously, if you've come back from Bangladesh, for example, but here it is required and it's actually for your benefit. So that's something we can do as youngsters, explain the procedures and maybe even accompany them, go to the doctors and nurses with them, ensure that everything is explained, ensure that they're comfortable. But can I come back to you then, Dr. Suhana and Dr. Rumina, and ask you, so how can we balance doing the right thing but also looking after our mental health, please? So Dr. Rumina, please, first.
It's a really tricky one in that I think the only good thing that's come out of COVID really is I think people are more open about talking about mental health and struggling with anxiety and stress. It's one of the few things that's good that's come out. People are more open and discussing it.
Yes.
I think it's natural to be stressed, and I think most people have a form of anxiety about something. So whether it's work, whether it's the health of your family, whether you've prayed on time, whether there's an anxiety. There's an element of anxiety for everything, and I think doing dua and being grateful, alhamdulillah, for what you have in your health should help to sort of settle things, inshallah. But also, if you do have stress and anxiety, I think it's okay to be stressed and anxious. Have a think about it, have a time to yourself, maybe take a time out, spend some time alone, spend time with family, whatever helps to comfort you, because it's okay to be stressed and anxious. Sometimes people tell you you should get over it or move on, and that was perhaps a few years ago where you felt like it's not okay to feel unhappy about something. But I think it's healthy to embrace your different thoughts and feelings about something, and also the elderly population and the younger population, just to say it's important to be open and discuss these things, and sometimes a problem shared is reduced often. So that's my feeling about it.
Thank you for that. And Dr. Suhana, please.
Yep, I mean, I'd really echo everything that Dr. Mirza said. I think if you are, for us, of the younger generation, I think if we do have older family members who we do have that kind of closeness with, that kind of relationship with, where we can have these conversations, if they're not starting those conversations, then, maybe we need to, and it's important to kind of have those conversations and kind of really talk about it. And just I think one of the biggest sort of barriers to maybe going to appointments like this is just the fear of the unknown, not being sure what's going to happen. So actually knowing what's going to happen can often make things a bit easier and can make people feel better. The other thing I would say is what Dr. Mirza said before, is I would really say don't Google things. I think, we are living in a society where, we're always connected. There's always lots of information available on the internet. And whilst I do think it's important to educate yourself, and it is important to kind of know about the symptoms and things like that, you can also kind of really go down a rabbit hole of just reading, lots of things and kind of convincing yourself maybe that you're more ill than you really are. So I think, if you are going to Google it, I think make sure that you are sticking to kind of reliable websites. So, excuse me. We do have the NHS website where they do, put out, the information about kind of what the screening is, what the symptoms are, things like that. So if you are going to kind of go down that route, make sure that you are using reliable sources of information. So like the NHS websites, for example, or other kind of, Cancer Research UK websites, for example. So making sure you're using reliable sources of information to actually get that information. And I think, as you said, it is a balance. I think, as Muslims, we know that, whatever happens, whatever happens to us is what's, Allah has decreed for us. But I think at the same time, the Prophet ﷺ told us to tie our camel, and that means actually by saying that means taking the means that we have available to us towards something. So, alhamdulillah, we're very lucky. We live in this country, we've got a free health service. We have these screening programs. So these are things that are offered to us. So we should take that. We should take those means to attend the screening programs. We should take, if there's something that we're worried about, we should take the means to contact our GP and kind of get an appointment and talk it through. So we should take the means that are available to us to kind of protect our health and to look after our bodies.
Thank you so much for that. I mean, there are so many important points that we've touched on, and there's so much more that we can cover. But I think the one thing that we can all agree on is that what we're really saying is, cancer is widespread, unfortunately, for whatever reason. And, we're finding that it's affecting a lot of people out there in our communities. Sadly, for example, in the last year, I've had a family member who was afflicted by cancer, just totally out of the blue, subhanAllah, and it was such a shock to the family, and naturally it was a very stressful time. But also, in my line of work, at work, for example, I have a colleague who was afflicted, and that also came all of a sudden. So naturally, we just find ourselves surrounded by people who are being, affected by cancer. And also, we may think that, it's not going to be me, it's not happening to me, this was my relative, this was my friend, this was my colleague. But that's what we're trying to avoid, isn't it, really? So just to ensure that it's not you, what you need to do is, book that screening that you've been called for. Don't delay it, don't avoid it anymore. Or if you have questions about it, simply go and ask to speak to your GP, or, as our guests have kindly advised us, look at the appropriate websites, the NHS websites, and find the information you're looking for. If you can't find the information, go and speak to somebody reliable, at your GP, or even somebody, in a professional capacity who can answer your questions. And also, I think even in our communities, you'll find that classes are being provided on awareness of cancer screening. And actually, on this point, I wonder if I can ask again, Dr. Suhana and Dr. Rumina, are there any programs that you can suggest, perhaps, which do run in the community or even in the NHS, for people who would like to know more? So, Dr. Rumina?
So to the best of my knowledge, there aren't any programs that kind of, in terms of sort of educational programs. But there are really good, reliable websites that you can use. The Cancer Research UK website is a really good one that's got lots of different information about the various cancers, the various cancer screenings, some of the signs and the symptoms to look out for. So I think that would probably be the best, that would be one of the best sources of information, or to actually, speak to a practice nurse or speak to a GP, or sort of somebody else who can kind of help you with that.
Agreed. I don't think I know of any programs that exist for learning more, but the websites. Other things, I guess, some of the charities themselves, so Macmillan Cancer Services, so there's sort of palliative care, Cancer Research UK, and actually you could go for the specific cancers if you want to know specifically. So most of the cancers have their own charity, and they have support groups and things like that they can educate you a bit more, give you literature, breast cancer as well as cervical cancer, prostate cancer, lots of different types.
I'd like to thank you both so much for all the information and advice you provided for us today. Sadly, we have run out of time, but I would like to say Jazakumullah khairan to our audience for joining us today. And thank you so much, Jazakumullah khairan, Dr. Suhana and Dr. Rumina. And inshallah, we will see you again next time. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum.
Assalamu alaikum wa rahmatullahi wa barakatuh.